Thank you, everyone, for joining this December CTIPP CAN call. Hard to believe that this is the last CTIPP CAN call of the year. Hope you're all doing well. It's been an amazing year for the movement. As you'll hear, Jen's got a wonderful presentation, as well as for CTIPP as an organization. Really just want to give a quick shout out to Jen, Laura, and Whitney predominantly as our new team members that joined in 2022. The work that the team has done has just been incredible, and we are so excited by the growth that we're seeing within the movement as well as the organization, and are so excited to continue to build upon that foundation and layer on the knowledge and resources and capacities that we've developed as we move into 2023. Obviously, also want to take a moment to just really say a last piece about Dan and just remember everything that he did to get us to this point, and acknowledge and mourn the loss that we experienced earlier this year as an entire movement. But like we've seen in the last couple of months and we'll continue to see, just living into the legacy and the vision that he and many others have helped to lay out is so important. And so just grateful for everything that was done to get us to this point, and really looking forward to next year. And with that, want to thank everyone on this call and so many others that have been on other calls in the past. The work throughout the country and the emergence of the movement so far beyond just CTIPP that we are seeing is a testament and to the strength, the continued advocacy and ongoing emergence of best and promising practices throughout the country. And that's thanks to so many of you. And so we are so excited to continue to learn from you as we move forward, and really, really looking forward to not just 2023, but also what comes after that. But for now, we have a wonderful CTIPP CAN call lined up for today. I'm going to pass it over to Jen very shortly to introduce not just the topics, but also go over our policy year in review, and it'll be very, very exciting. So Jen, without me saying anything else, I'll turn it over to you for that update and review.
Thanks so much, Jesse. Hey, everyone. It's good to be back with you all this month. It's been a very busy month in Washington, D.C., as is very common for the end of a congressional session. So I'm excited to update folks on some of the things we were able to accomplish over the last month, as well as just a recap of everything we've done together over the last year. Before I get into my slides, though, I just want to take a moment to just hold space for the people of Ukraine right now. We know that many of them are without power, they don't have heating, they don't have electricity to cook their food. So we're really thinking about them and the trauma and suffering that they're going through. Of course, it's relevant to policy, as President Zelensky is in Washington, D.C. today, meeting with policymakers. I think it's just relevant to those of us who are concerned about trauma and its various causes. And so just as we go into these cold months, just thinking about and creating warmth in our hearts for the people of Ukraine. And then I will start sharing my screen and we'll get into it. So we've done some reflecting at CTIPP about what we've been able to accomplish over the last year. And I wanted to share just some top numbers and some key accomplishments with everyone. This will take no more than 10 minutes. And then at the end, just share our latest call to action and a new campaign that we're really excited about that we're going to kick off next month. So the first thing is that CTIPP really ramped up our endorsement of legislation this year. And so when bills were introduced or as they were being drafted, we really got involved and then put our stamp of approval on a number of bills that we thought were really important to advance what we're trying to do in the healing movement. And we are, excited to share that the legislation we endorsed outperformed. And so of all of the thousands of pieces of legislation that were introduced in the 117th Congress, only 18% of those bills ever made it past introduction. So that's a a markup or a hearing in committee. That's a vote on one of the chambers. But of our endorsed bills, 56% of them moved. And we did a lot of, our endorsement means we also put calls to action behind the bills. We also put educational efforts behind the bills. We really think that that moved the needle for us. And then of legislation that got introduced in the 117th Congress, only 1% of those bills became law, but 22% of the bills that CTIPP endorsed and organized behind became law. And I just want to mention and spotlight two of them, and this happened within the last few weeks. So we've talked a lot about the Post-Disaster Mental Health Response Act. CTIPP did a lot of work around this bill over the last year. This is a bill that provides reimbursement for communities that are struck by disasters, whether that's a mass shooting, a terrorist attack, a natural disaster, so they can receive reimbursement to create really community-driven resources. So it's not just counseling, it's things like a peer support group that supports people through that process, educating each other about trauma and how to recognize the symptoms of trauma, maybe a hotline, a mental health support hotline staffed by locals. So we're excited that that became law, or that was passed through both chambers in the NDAA. The president will sign it any day now. So that will become law. And then the McV program, which is the maternal infant early childhood home visiting program, was set to expire if it wasn't reauthorized. We joined a number of other coalitions, and we had a call to action that was open throughout the year to make sure that that was reauthorized, and it was indeed. It is included in the omnibus, which is passing both chambers this very week. So that's expected to be extended another 5 years. That provides home visiting, which is really proven to improve maternal and child health and family stability, child development and school readiness. It was also increased funding by a very significant amount from about 500 million to 800 million. So those are just two examples. And if you've joined our calls to action and written your members about this, we're so grateful for that. Another key stat, 66 of the bills that we endorsed were introduced on a bipartisan basis. And good policy doesn't have to be bipartisan, but making sure that we are building bipartisan support behind good ideas really helps us to make sure that we're successful in getting them across the finish line. Often bipartisan support is essential to getting things done. And so we've been really intentional about building coalition on both sides of the aisle to prove that solving trauma is definitely not a partisan issue, but we have to be intentional about making that the case. We got a number of really exciting wins in the omnibus that is passing the House and Senate this week. One of them is school-based trauma support. So there are grants for schools to use to transform into trauma-informed environments. And that was funded at only $7 million last year. And between the omnibus and the Bipartisan Safer Communities Act, we bumped that up to 40 million in FY23. So that is a more than 500% increase, a huge amount of money. These grants are relatively new. And so this amount of money will help to prove how successful they are and really demonstrate the traction there. The SAMHSA run Interagency Task Force on Trauma-Informed Care. We were successful in getting first-time funding for that task force. Last year, that task force is supposed to put out guidance on best practices in trauma-informed care, ways that federal agencies can better lean in on trauma-informed practices. So we were able to double that to $2 million for the next year. Research on ACEs at the CDC, we were able to get a 30% increase there. And as I mentioned with the McV program, we did secure that 5-year reauthorization, and we did increase that funding for the next 5 years. And then one of our big priorities, of course, is education. And so we do some lobbying work for funding and legislation, but we really focus on educating anyone in a policymaking position, as well as educating people across the country about what's happening in Washington, D.C. So over the last 9 months since I've been on staff, we've posted monthly Washington, D.C. updates on PACE's Connection. We've received 1,893 views on those. We're really excited to see people reading those and really staying up to date on what's happening on policy in Washington, D.C. We've had 12 CTIPP CAN calls. with 6 Congress and agency staff presentations to really keep the communication open both ways between our network and policymakers. We published our first ever policy brief report on trauma-informed schools that was received by 545 congressional staff. It was viewed by more than 50 staff members in the US House and Senate. And we ended up briefing the Department of Education, that's the image that you see on the bottom right, a couple months ago on what it really takes to transform schools into trauma-informed institutions. We also released a trauma-informed government grants report where we reviewed 24 available grants that were open through the month of October that folks in our network could apply for or encourage their state or local government to apply for. And then earlier in 2022, we helped 6 groups apply for earmarks through the appropriations process. And that's sort of our quick snapshot of 2022. As Jesse mentioned, we'll have an annual report out that goes into all of the details. But I wanted to take a few minutes after the recap to talk about a new campaign that we're very excited to launch next month in January of 2023. Excuse my typo, I have not adjusted yet. January 2023, this is the Take on Trauma campaign. And there's a lot of components that have gone into it. I can preview a little bit of it today. Essentially, the Take on Trauma campaign is to encourage the 118th Congress to be the Congress that finally really takes on trauma and advances the legislation that will heal communities and build strong communities, fund these programs at what they need to be funded at, and pass legislation. And so you may notice some well-known figures in the background on the screen. We've partnered with a number of members of Congress in the House and the Senate, both Republican and Democrat, to launch this campaign. And we'll be able to share more about that next month at the launch, where we'll have an opportunity for you all to take action in promoting some new media that we're having coming out. But in the meantime, we do have a call to action. If you go to ctipp.org/action, you can join us in this campaign. We have written one letter, a one-page letter, that we will send to every member of Congress. And it will be signed by their constituents. So that's you all. And so we're hoping, we're at 486 signers so far. We're really hoping to get to 1,000 so that we can send each member of Congress a letter with a list of their constituents who support them taking on trauma and prioritizing trauma. This timing is really important because it's the start of the 118th Congress in January, and Congress is setting their priorities. Each member will set their priorities for the session. So we really want to start strong. There's also an opportunity at the call to action to leave a comment about why taking on trauma and addressing trauma is important to you. And we'd love to share those with your member of Congress and your representatives to further educate them on why their constituents care so much about this issue. So we really hope you'll join us, ctipp.org/action, and we will have more to share at our next call. So that concludes my presentation. As Jesse mentioned, we have a really exciting call today. We have a couple of fantastic presentations, and we have them in a little bit of a wonky order. So what we're going to do is we're going to hear from 2 presentations today. One is an incredible staff person who works at the Department of Health and Human Services, who was the lead on a really exciting new interagency plan. So we'll hear from her later in the call. And then towards the end, we're going to wrap with a presentation from our friends at Iowa ACES 360, where they're going to present on strategies for how to create a message for advocating around trauma that is really effective. So this is going to be all about how do we tell the story of how important it is to address trauma in a way that will be effective and persuasive, regardless of the audience, regardless of who they are, what their life experiences are, what their political leanings are. And so we really want that presentation to start a conversation among us about how we want to really talk about these issues in a way that's effective. So we're going to spend the next 10 minutes to sort of set the stage for that conversation and do breakout rooms. So we're going to do 10 minutes of breakout rooms. We want folks to get together and just talk about what challenges you faced in communicating about trauma and the need to address that. So whether you've struggled to communicate to friends and family, to decision makers, to colleagues, what kind of challenges do you face in educating people about the issue and advocating for solutions? What kind of sticking points, what kind of feels awkward, what's uncomfortable, what's not working, just to get a sense of, you know, where we want to build from here. And when we come back at 2:25, we'll have folks, if you'd like, just post some thoughts and reflections in the chat while we give everyone a 5-minute brain break. After that brain break, we'll launch into the presentation from our friend from the Department of Health and Human Services. So Jesse is thumbs up. We're good to go on breakout rooms. Great.
All good on the
Awesome.
breakout rooms. Happy to, just one quick question that's in the chat. Ruth asked if we want sign-ons from individuals or organizations, and the answer is both. When you go to, you can sign on mostly as an individual, but there is an option to put organizational affiliation if you'd like. When you go to that sign-on letter to urge the new Congress to take on trauma. And as Jen said, in addition to your signing, we're going to reach that 1,000 by you also sending to others and encouraging them to sign. So please do that. But without any more delay, I'm going to go ahead and open the rooms. You should automatically be moved. And then we'll send a note. You'll see a timer for the 9 minutes before there's 1 minute close before it closes. And then we'll all come back together. So looking forward to hearing the report outs or reading the report outs. Thanks, everyone. Hope it was a good conversation. And as we move forward, we really want to make sure that we're centering your experiences, your expertise, and learning from all of you as we continue to move forward. And so the engagement in these calls will continue to be facilitated through 2023 and beyond. That's a huge priority of ours. As Jen said earlier on, we welcome all comments in the chat about what you learned, what you discussed. Please have those come in. We're really excited to hear what you all discussed about or read what you all discussed. And again, I'll put one more quick throw out there for that call to action on our website and making sure to circulate that your conversations, your championing those letters is how we're going to be able to reach more voices. And so very grateful for your support at all levels. But without further ado, I want to introduce Erin McDonald, or more appropriately, Jen. I'll throw it over to you to introduce Erin at this time for a very exciting presentation.
Great. Yeah, thanks. And as Jesse mentioned, you know, if you want to share your reflections, please put them in the chat, but try and do so right now so we're not being too disruptive of Erin as she sort of takes the stage. But we'll reconvene on that topic at 3. Without further ado, so Erin McDonald is here today to present with us. She is the lead of the Equitable Long-Term Recovery and Resilience Plan. And she works in the U.S. Department of Health and Human Services, Office of the Assistant Secretary of Health, and the Office of Disease Prevention and Health Promotion. And we're going to have her present on the Equitable Long-Term Recovery and Resilience Plan, which was just launched. So Erin, I will turn it over to you. And Erin will leave about 5 minutes at the end for questions. If you have questions as she's speaking, feel free to put them in the chat. Otherwise, we'll open it up for live questions at the end. Thank you.
Great. Thanks, Jen. It's a pleasure to be with all of you. I've heard incredible things about all the work that this group is doing. I'm going to pull up slides here. So give me 1 second to do that. And let's see. Okay, here we go. All right. So I actually, just as context, I had the pleasure of being introduced to Jen and Jesse and team through colleagues in the Office of the Surgeon General who are doing a lot of work around efforts that relate to belonging, well-being, which is directly related to the federal plan and the approach that we've taken to develop that work and the partnership that we have, and they are included in the body of work that we're developing. I'm going to share a bit of headlines today with you. I'll share some resources as well, and would love to be able to hear your thoughts, reflections today as we have the conversation, and then in the future, if there's opportunities to keep the conversation going. So I'm going to share a bit of background first, just to get us started. So I'm going to take us back just for a moment, because I think it's helpful to re-anchor in what we were seeing in the beginning of 2020. We've obviously come a very significant distance since that time, but we're still, and you all are experts in this from a lot of different perspectives, we are still really facing both the pandemic and a number of other both traumas as well as shocks and stressors that were pre-existing, but were also exacerbated by or have been introduced, during or as we've continued to really address the COVID-19 pandemic. But at that time, what we were really seeing, both from the data and from kind of representations in media of data and experience, which are highlighted on the screen, is the fact that we were seeing significant reductions in degrees of thriving, which in this country were not high to begin with as a prior state from the pandemic, but that we were seeing huge drop-offs in those measures, as well as mental health, economic resources, food security, and all of those other conditions that are incredibly intertwined. We also know that since that time, there have been a number, as I mentioned, of other layered disasters that have happened to both the nation, overall in terms of social justice and the outcry for really engaging in a very different discourse that we've continued to see, to geographic representations of hurricanes, fires, floods, et cetera, and that those are all layered on the experiences of challenges that people and systems have every day, from poverty to belonging, connection, and the kind of the dis-ease that we see across very different populations. So with that picture in mind, one of the things that was really important in the early onset of the pandemic from a federal perspective is that there was a body that was formed and is stood up every time we have a disaster. And this was obviously incredibly unprecedented. So the group around the table was quite significant in terms of who were responding. And these are senior career staff that are across the federal government, from FEMA to CDC to HHS to transportation, that actually form what is an integrated mission space that looks at responding to those needs. And one of the things that leadership team really recognized is that we were all as a nation addressing, what do we need to do in the next hour, the next day, the next, few days or week, but we were not grappling with, but we were seeing the data that was evidencing this was not going to be short-term. This was going to be both a very long-term, not just recovery, but reimagining and rebuilding a forward direction, but that was not created necessarily directly by the pandemic, but by decades of very deep inequities and really the issues of very fragile systems that were addressing needs that they were not built or resourced to address in a lot of different ways and how they were working. So with that recognition, there was an objective that was set that became what the seed was for what is now the Federal Plan for Equitable Long-Term Recovery and Resilience, which I'm just going to call the Federal Plan because it's a very long title, because there's a lot to really capture there. But in that frame, it was really to look at a leadership perspective of how do we change that curve? How do we really actually think about the role that we play as partners and the resources that we have as partners in the federal landscape to contribute to addressing the question, what is it going to take to reach greater heights of well-being, equity, and resilience as a country? And how can we play a role in that with the resources that we have to bring to bear? One of the things that I'm sure is all present for all of you, but is really important to point out, is that there's a very clear relationship between, but understanding that there's an interdependency between how we think about where the majority of our focus is around a response, which is around urgent services, right? Really looking at immediate infusions or gaps to stabilize communities, households, individuals, systems, et cetera. And that's really about recovery. that looks at a shorter term horizon, but that there's a relationship also to where we're making choices about our focus and how we're then thinking about those same needs and addressing them through thinking about a frame of resilience, where we have an opportunity and a need to place more focus and what we've really articulated as those vital conditions, which are rooted in the same needs and the same relationships, but it's a very different way of addressing those needs and understanding how we support them. From, as we've talked about and throughout the plan, if you're interested in taking a look, trauma-informed and healing approaches to really think about the ways those systems are engaging with different communities and different layers of how we interact in those ways. So we know, and there's a, not to boil it down to an equation, but there's a relationship here. We know that if vital conditions are not fulfilled, then urgent services demand grows, and that is not going to help us both in the context of recovery and moving forward from the pandemic or any other event or need within a community that is both chronic or episodic in its experience. So that was the relationship. So thinking about those dynamics of the context we were in, the relationship of the ways those services or needs are really addressed or fulfilled in that relationship of provision, the federal plan really looks at this position of the steady state resources. And what I mean by that is that we are focused on thinking about the breadth of the resources, which is incredible. It is vast and deep, a number of resources that exist across the federal government, across departments and agencies that we can bring to bear that are available every day, that are not solely dependent on an event that we are responding to happening and that are available for a short time. But how do we better attune the resources that we have to look at how we can achieve better resilience from an equity perspective, and how that supports greater degrees of well-being. I'll come back to that in the ways that we've addressed this, but the through line is really looking at how do we leverage the federal plan and the frame of the vital conditions to really provide a lens through which we can look at our use of the infrastructure and the steady state resources that we are able to bring to bear in those relationships. In that context, it's really important to represent the fact that the work that we've seeded in the federal plan did not start in the federal government. It resonates there. It's important to really align, but this work started in the civil sector, and it was actually seeded by a group of incredible leaders. There are over 100 organizations that came together even before the real onset of the pandemic to identify and develop through the lens of the vital conditions as a shared framework of reference. What could they do as a system? How could the civil sector better support communities in ways of realizing equity and resilience and the ways that they are working to support those needs? That is complementary to, but independent of, the federal plan. And what we've named is, what can federal partners do to better support communities and systems realize resilience in the ways that the resources that we are making available can be able to support those needs. And I'll come back to what I mean by resources in a minute. The state and local relationship is also important because there's been an incredible amount of work across the country that have been where leaders and systems are driving either from counties to communities to state systems to networks of organizations that are doing this work and really advancing role model perspectives around what does it look like to practice in a way that's supporting and focused on building resilience and thriving in the ways that those systems are working in communities. I'm happy to share examples of those. I'll spotlight a few of them. So in this context, this work was actually, the federal plan was developed and actually seeded in an apolitical manner before the Biden administration stepped in. As I was mentioning, it really was seeded at the beginning of the pandemic. And as the administration was coming in and identifying a complement of real priorities, which are listed as highlights here, there's incredible synergy and alignment in what the federal plan was calling for and where we were seeing real energy, both around the principles and the real priorities that are significant in how they're thinking about advancing real needs and challenges that we need to address across very different systems. So within that context, there was a group of, a smaller group, I will say, about 20 different departments and agencies that have now grown to, we're actually up to 45 departments and agencies that are part of this work. And we're really at a point of growth and development. So because the federal plan is out, that does not mean pencils down. It means that we're really in a perspective of building and thinking about action and seeding or catalyzing ways that we can realize what this looks like across federal departments and agencies and as a system as a whole. So this is a visual of the range of different departments and agencies, and you can see it ranges from EPA and FEMA to National Endowment for the Arts and the Humanities and HHS and Department of Justice, right? Very different environments that are really thinking about, but really desire the ability to think about how do we better realize and use our resources to come together in the way that we can apply them in concert. That is not a new idea, but it is one that takes a real perspective about what are the actions and what is the framework that we use to actually help achieve what that looks like in practice. So beyond the plan itself, which I'm going to highlight, there are 4 really clear pivotal or philosophical shifts that the plan calls for in the way it's asking federal government to work, in the way that it's providing and thinking about the resources that we can bring to bear. The first is centering community. So really thinking about what are the assets and the needs of communities versus what are the programs and the systems that communities need to fit into, and really having a very different frame shift in how we think about those resources. The second is having a very clear shared goalpost around equitable resilience. That does not mean that departments and agencies shift their priorities or their mission space, but it begs the question of how do our individual and collective resources improve resilience and well-being for communities that we are working to support or enable in terms of the work that they are doing. A shared framework to really center the work and to have as a reference point that can be an umbrella or a tent that we can really understand the relationship of how the work is anchored. And then finally, and really importantly, a shift in lexicon. I think this is important in how we speak to each other across systems. We use the same words for very different meanings, or we speak very different languages about the intention of what we're seeking. And it provides an opportunity to acknowledge and identify what are ways that we can share a lexicon or language that is much more accessible and transparent, especially to communities and partners outside of the federal landscape that are seeking to be in partnership and really avail themselves of the resources that are important for their communities. So this is a visual of the vital conditions. I won't hover here, but I'll make sure you have the webpage if this is something you want to dig into further. We have a wealth of information on the federal pages and then partnership web pages where you can take a look, but you can see that it's very asset oriented, it is very system oriented, and it really provides very clear sub elements that speak to what would it mean to have or achieve a vital condition. This is a foundation. It does not mean that one can't go well beyond these subconditions, but that these are core elements that we believe are important to achieve any of the given vital conditions. Importantly, it also is centered around belonging and civic muscle, which is a relationship that I see in the work all of you are doing and leading, to think about that as a vital condition in its own right, but also connected to the relationships of those other vital conditions and how they're realized. One important thing that comes up quite a bit in different spaces, I thought this would be important for this group, is that I think we get sometimes stuck in a lot of different frameworks. And this is less about needing to champion a particular framework. It's a tool, it's a vehicle that's helpful. We found it helpful to really frame around the vital conditions as an asset and kind of, forward momentum framework, but that there's a relationship between the social determinants and the vital conditions. The social determinants really speak to kind of a neutral or negative frame of a condition or a state of being that one can describe and understand. It's important to be attuned to. The vital conditions provides a clear orientation to what are the things or the resources or the conditions that we want to see in place to be able to address a number of those social determinants, and others that actually are well beyond the social determinants and their relationship to how we think about the needs in communities. All right, I'm going to move through a couple slides really quickly. One of the things that we did, and it's available on the web pages, is really think about, as we call it, demystifying all of the different assets or the ways that we work in the federal landscape. There are a lot of resources that sit within departments and agencies. And how do we help many different communities and systems understand, have awareness, and potentially access those resources if they are important? One of the ways of doing that is also stepping back and not looking at specific programs or actions or policies, which are deep and important, but that we can help to understand and categorize the ways that we work. So at a high level, these are the types of levers that very different departments and agencies have different degrees of to exercise and to really think about the ways that they are working, which includes funding, but is well beyond funding in the ways that we support communities, from data to technical assistance to policy, regulation. That's the way that it is at a higher level organized. We also then looked at, we had an objective to really think about using that framework and really understanding the need to create a space of transparency across systems. How might we actually use the vital conditions to demonstrate where those assets and the ways that we're working fit across the landscape of the federal government? That's what these visuals represent in a kind of a visual, or it's intended to show all of the interconnections of departments and their relationships to the vital conditions. We also, importantly, what I'm going to land on here is we mapped those assets across those departments to the vital conditions. So if a department or agency has one or more assets in those categories of the vital condition, it is represented by a colored or full cell that is aligned to that row of that department or agency. There are dots on this slide that are important because in the federal plan, there are recommendations that go well beyond listing resources that exist. And it really represents the fact where we have a colored dot and not a cell that is filled in with that color. It means that that department or agency has an asset that we believe is important to advance a recommendation in a vital condition that isn't necessarily where they see, their mission space or where they would identify that resource existing. So there is incredible interdependency in the ways that we work and how we can better leverage those resources. So there is a tool online. You're welcome to play with it. It's in Excel right now, or take advantage of it. I'm happy. I will share the link to where these resources live. But it allows you to go in and really look at in a live document that we will be updating in the beginning of the next calendar year, where resources are. But you can look at it not from a department or agency perspective, but if I'm someone that wants to understand what the resources are that address humane housing, right? And an element of that, I can look in humane housing and I can access all of the resources that we have listed across departments and agencies, or within a department and agency if I'd like to look at it from that perspective and learn more about what those resources are, and then be able to connect to what that resource is. So it provides a lens of unpacking and creating transparency around the ways that we can understand and access resources. All right, so I'm going to bring us home really quickly by sharing a bit of overview about the federal plan, which is also available online. So you're welcome to look at either the high-level summaries or the depth of the material that is shared on the web pages. So the 4 goals or the objectives of the federal plan are shared here. Equity is a cross-cutting orientation or goal or principle of the federal plan, both from the perspective of equity and accessing federal resources. One of the things that you'll see in the federal plan is a number of recommendations or actions to support communities that do not have deep pockets in grant writers or necessarily the ability to navigate very complex federal systems, and how can we better support them to access those resources in ways that have meaning and value to their assets and their needs. It also really looks at equity and outcomes and how we experience resources and benefits for different communities or different groups that are supported by those different resources. The federal plan, the primary audience of the federal plan are federal leaders and actors, and that's because it's all about what can federal departments and agencies do to better align and to use their resources in ways that can be in support of a recommendation that would advance long-term resilience and well-being in very different contexts. So that is the primary orientation, but there are incredible amounts of information that can be beneficial and collaborative to groups that are in partnership with federal government to think about how we do that well and where there should be priority in terms of what actions we should take collectively, and where there's opportunity to really look at it complementing with other actions well outside of the federal government. The plan is organized around the vital conditions and recommendations that speak to those, but it also really elevates and looks at a group of recommendations that we call multi-solvers, because they could actually create benefit across a number of vital conditions. One of those examples is broadband. That's a very large example, but broadband is an incredible opportunity, not just to be a mechanism for connecting, but to help with health, to connect with belonging and connectivity in communities, to look at workforce, to look at education, right? That's, apparent in ways that we can really understand, but the plan in that recommendation calls for actions that federal actors can take to make sure we are realizing that asset of broadband in a way that really does support those different vital conditions, and what are ways that we can make sure it's connected to other actions or resources that are happening within the federal landscape to achieve a different outcome or an improved outcome about what we'd like to see. All right. So I mentioned at the headline that there's an incredible amount of work happening. So this is the visual or the map on the left side of the screen is a representation of very different communities leading on this work in very different ways from a systems perspective in their own right. And they're well beyond, this group that are highlighted. There's also network-based approaches from the WINT network to the YMCA that have adapted the thriving orientation or framework to their work and are really leading in the work that's happening here. There's also a significant amount of work happening in the federal landscape. Even as we are just sharing out the federal plan, there's work that is off and running in terms of really being a catalytic opportunity that we intend to really build on as the work goes forward, and we share and really develop an opportunity to create more demand for what we've called for in the federal plan as an opportunity. But these are some examples of work that is happening already. So next steps, we're really working on, I am here today. A big part of what we're doing is really having dialogue. And I know I'm doing a lot of the talking right now to share, the work so that we have a shared baseline. But my hope and expectation is that we can keep the conversation going. I would love to learn more about the work that Jen and Jesse have shared with me that all of you are doing and thinking about in your very different contexts, so that we can be in partnership in ways that are valuable and can elevate the ways that work is happening in alignment with what we believe is important around well-being and resilience. We also were really focused around developing those bright spots of where action is happening and really continuing to build a momentum towards a lot more of that work happening. And then we are focused around really thinking about what is shared data and learning that would create a broader understanding and awareness about the work and how we understand different aspects of that in communities. So I will leave you, I'll pop in the chat. I want to make sure I leave a little bit of time. So I talked really fast so we can go back over anything that felt like it was too hurried. But I will share the resources that we have. Let me pull that up so I can grab that. And I will pop it in the chat for you all in case you'd like to take a look or explore further. So that I just popped in there. But so the resources are included there, the web pages. And as I said, I would love to be able to think about what would it look like to have deeper conversations, or to think about hearing more about the work that you're doing and how it resonates, or where you think it should be pushed further. So Jen, I'll turn it back over to you.
Thank you so much, Erin. I think it brings me so much hope, and surely other people in this group so much hope, just to see some of the things that we've been talking about, ways that we wish the federal government functioned, reflected in this presentation, this multi-sector approach where you were able to wrangle all of these agencies to actually talk to each other and see where are our assets, where do we have gaps, where do we have overlap, as well as moving from thinking about meeting people's basic needs, which a lot of people think of as shelter, food, clothing, to actually what does it mean to bring people in a space where they're living well. And that vital conditions framework is a framework that I can see a lot of folks on this call starting to adapt as the ways that we want to move communities into, and really thinking about especially that belonging is such an important solution to the experience of trauma. I think that definitely can be shared. I know Jesse mentioned that he saw a question in the chat, but I also welcome folks to just share reflections and thoughts. Doesn't have to necessarily be a question. Jesse, do you want to chime in?
Yeah, thanks, Jen. And thanks again, Erin. A real quick clarifying question, I think, from earlier on in your presentation, but Tara asked, is life ratings a level of happiness or a years of life indicator?
Life ratings, which from the thriving slide, is that what was being referenced?
Yeah, I think so. It was from early on in the presentation and just wanted to uplift it.
Right here, US life ratings. Yes. So so that's a great question. I can share the link, Jesse and Jen, if you want to share it out with the group. But this is a measure that Gallup does on a regular basis, and it looks at self-reported degrees of thriving or well-being. Thriving in that is in that scale as a higher rating of well-being. So it's a classification or a category of that self-perceived experience of how am I doing across different categories? Do I feel, that I am struggling, surviving, thriving in that relationship of my self-experience? And there's a literature behind this that some of you may, I'm sure, know well, but I will share it in case it's of value to others that would be interested.
Thanks, Erin.
One of the things I know, Jen, you mentioned, I can make sure I share this. I didn't include it just for brevity of time, but I should have thought about this with the group as you were talking about the framework and the value proposition there. The way that it's typically expressed, it's also demonstrated as a buildable relationship of actually starting with understanding that we have more people and communities that are struggling and surviving relative to thriving in that experience, and that we want to change that dynamic. But a part of that is also not just providing resources in a way that address these vital conditions, but grappling with and being present to the legacies that have created the reason that we are in this state of being for many communities. That is not a new thought to this group, but I think in a framework, it's important to represent and also to acknowledge what is the interface of those relationships and how that makes a difference in not just provision of services or resources in these different areas, but the underlying realities that we need to grapple with in order to make a change that is fundamental.
Thank you. I see Jeffrey has a hand. Jeffrey, would you like to chime in?
Sure, I'll be glad to talk for a second. I speak only for myself, and I would say, Erin, this is a terrific presentation, very well laid out, but it has about as much reality as Santa Claus. I started out in community action when Ronald Reagan was president, and he said, the government is the problem, and it's gone downhill from there. There's been a good study of COVID responses around the world, which demonstrated that those countries that were most successful were the ones that had the most trust in government. I live cheek by jowl with homeless people. I have patients who cannot afford medical care and are uninsured. We have people that are hungry in my community. The taxes are incredibly low, and the billionaires are running off to the World Cup. I just think that this is a breeze in a hurricane of inequality and federal abdication of responsibility. Everybody knows we can't trust the government. They're withdrawing COVID medications and vaccinations that were subsidized. They won't give up child tax credits. And the omnibus bill, the Pentagon got a huge raise, and CAPTA and the Family Violence Act were overlooked. So this presentation is meaningless to me.
Okay, thank you.
We have a couple other hands. Richard and Max, maybe I'll give you each a moment just to share some thoughts, and then I know we have to shift to our next presentation.
Sure, this is Richard Taylor, and I want to counter that comment by saying that we were involved with developing the 7 vital conditions of well-being. We're a member of the Well-Being in the Nation Network, and we're thrilled that the federal government has selected that model. And we see this as a huge step in the right direction because, yes, as the previous person said, the past, some of the programs haven't worked as well, but this is going to make the federal programs work better and work in collaboration with the state and local groups. And so we're doing it right now with a 14 county community in Tennessee where we have state and local resources. We have 25 million and we're working with to solve poverty, and we welcome the federal government to join us with the federal agencies because there's 80 of them out there that have something to do with poverty. So thank you for this presentation, Erin. I look forward to following up with you on this.
Thank you, sir, for
Thank
that
you, Richard.
follow-up. Keep fighting. Keep the fight on.
Thank you.
And
I would love to learn more about your work, Richard. That would be great. Yeah. And I will say, I think that your proof point, this is not easy. This is not a flip the switch, or I'm not here to self-aggrandize in any way that this is, we figured it out, but this is an accountability that we all have to have in a big system that we're all a part of. And that these are very deep challenges that we're all grappling with. So from very different seats at the table. So I appreciate the real orientation to wanting to think differently around that we have to think differently to create something different. And I appreciate that.
Thanks, Erin. And Max, just last comment quickly.
Real briefly, and Erin, I'm happy to connect more about this offline, but 2 quick points I wanted to mention and have been advocating for a while. And these are yes ands. In addition to the report, which I think seems to focus on existing services, and a bit to Jeff's point, I've been trying to talk about times where existing services aren't helping and raise that as an acknowledgement across the trauma-informed community. There's a paradigm of just get you to a resource and that's the solution. And there's so many people where the resource currently does not exist and there's nowhere to give that feedback and help. That's 1. And then 2 is the continued exclusion, intentional or not, of the lived experience communities in development of resources and feedback about resources. And that's an ongoing theme that I've been working with various people on this call. No, this is my thing. But I want to encourage HHS to also consider increased avenues for lived experience and community input and co-creation. And I'm happy to discuss that more outside of this.
I love that, Max. And I think that's named directly in a number of recommendations, not to say that solves for that in any way. There's a real accountability that we have to really think differently about what that looks like. So I agree with that. One of the things, I know we're over time, I will briefly say, the plan is not intended to be a solve all for all things, right? It is a starting point, but it's also about the reality that a lot of our we have a lot of resources that are steady state, meaning that we have them to be able to use, and that we are not dependent on going to request greater authority or new kind of resources, which take a very different avenue and time. And that is important in a lot of ways. So, but that is a complement to what we are naming in this space, that how do we better leverage or realize that the resources that we have in some cases are not necessarily helpful, or that we have a gap in some ways that we need to be attending to. The plan also calls out, and this is where this action is an opportunity, is how do we better align and refine and change a complement of resources. So it is not suggesting that what we have and how it's working now is the way that it should work to create a different result that we need in terms of the benefit of what that resource could provide if there's value there. So that's a very short answer. I don't want to do an injustice to it, but I love hearing that those are your focuses, and would love to learn more about, the work that you're doing, or where you think there's an opportunity to push further.
Thanks so much. All right, well, we should transition, but Erin, thank you so much for being such an incredible champion and ally. We're going to continue to have conversations about how we can move this along from an outside approach, outside of the government, and continue to advance this at the state and local level. But so appreciate you taking so much time to present this with us all. And we'll be in touch, but really appreciate you.
Yeah, thank you for having me. I look forward to following up, and thank you all for the incredible work you're doing. You are doing the hard work, and I really value that. So this is why I come to work every day, but there's a long road ahead of us, I know, but appreciate being able to create space together and have wonderful holidays in the ways that you're celebrating.
Thank you
All
so
right.
much.
Bye, I'll tune off. Bye, everyone.
Awesome. Well, thanks everyone. We're 5 minutes behind, but let's transition now. I'm going to invite Sara Welch onto the stage. Sara is with Iowa ACES 360, as I mentioned earlier. They've been doing incredible work to hone their own messaging and in their work with policymakers in the state of Iowa. They work with policymakers from all different political backgrounds and political leanings. And so they have an incredible expertise on how to talk about trauma and advocate for advancements around trauma in really challenging and dynamic and new environments. So excited to hear their presentation. And I think we may have a few minutes at the end for questions as well. So I will turn it over to you all.
Great. And I'll let Sara pull up our PowerPoint here, but I'll go ahead and start sharing here a bit. So thanks to Jen and Jesse for inviting us to join you today and to share a bit about what we have been learning about advocacy messaging. And I want to note that our work in this area was really possible because we have some philanthropic partners here in the state that really understand systems change and that were really behind us in looking at messaging development and testing and working with a collaborative group on this. So this has definitely been a journey for us. And we look forward to sharing some of the insights we gain, but I think it's really key that we all continue to learn from each other on all this. So my name is Lisa Cushatt. I'm the Executive Director at ACES 360, and Sara Welch is joining me. She's the real show here today and the smart person on the team, so forgive me while I ramble for a few minutes. She is our communications and network engagement contractor. When just a little background on Iowa ACES 360, we have been around for about a decade, started over a decade now. We started as a coalition, and for the past 3 years, we've been a separate nonprofit entity. We focus on mobilizing a network of leaders, both independently and collectively, to address ACEs. And so our mission, as you see it on the screen, is really about empowering the health and well-being of all Iowans and preventing and mitigating the effects of childhood adversity. I will say that our name, being ACES 360, is a little bit misleading, but 360 is the important part here. We recognize that when we're talking about trauma, and as you'll see in some of the messaging Sara will share, that we are really talking holistically, not just about trauma that happens in the home, but what's happening in the community, what's happening in the society, and what is impacting families. And we know that this is not just about prevention, but through healing communities and healing both more recent and long-standing trauma that has occurred to communities. And so that 360 part of our name is really important to us. We center our work in 3 main strategies. One being advocacy, which is where a lot of our research that Sara is going to talk about is directed today. We serve as the backbone infrastructure for policy work in our state and really cultivating that network of partners to do this work. We do, Iowa has collected ACEs data consistently since 2012, and we've had several reports that you might have seen related to it. And not just ACEs data, but we bring a variety of data sources to really look at both the history as well as the current quality of life of Iowans. So our second area is really around advancing knowledge, both from a research and training perspective. And then finally, our third area is innovative practices. We jokingly say this is the area where we do kind of the work we always all wanted to do in previous jobs, where we really work to with direct service partners to launch pilots, work with state systems to really shift how work is being done, and then to also develop some evidence base behind it. So what we're going to cover today is some of what we've worked on and some of what we've learned around shared messaging. But we also want to give you the ability to think about how this fits with your work and your advocacy efforts. And at the end, hopefully have a few minutes for discussion on what you need to effectively advocate and how what we've learned might be helpful with that. So as we talk about a shared advocacy message, really all of the issues that you, our team, all of us are all focused on is important. But when we think about opportunities to advocate, we also have to consider how to deliver the message in a way that gets heard. Not the way we maybe want to communicate or is easy for us to communicate, but in a way that it's also heard. One thing that's unique about being in a space of addressing ACEs and trauma is that so many issues tie into what's needed to both prevent and heal from trauma. There's not one issue or one solution that will reduce ACEs and promote healing. So when we do shared messaging, we're really creating in a broad tethering way the ability to help foster policy change by unifying all of our different issues. I don't know about you guys, Iowa is not a state that's filled with whose elected officials are all social workers, public health, mental health professionals, historical experts. If you guys have a makeup like that, let me know. I'd love to maybe pop in and see how it's going for you. But how can we talk about that bigger picture, especially with those who are not familiar with our work? We also really need to think about shared messaging in a way that frames how we see connections between the decisions that decision makers and all of us make and the impact on families. No policy decision is done in isolation of an impact on a family, and we really have to strengthen the connection between those. These are individual problems, but they're community system issues. And then finally, how do we really use share messaging to encourage all decision making to center on what people need to be healthy and well? That sole focus on not what we want to do or how we view things or how we view who's worthy or not worthy, but simply focusing on how our decision making can center on what people need to be healthy and well. So it's been really important for us as a team to think about. We have a maybe increasingly more conservative environment, and definitely have increasing perspectives on limiting things like social supports and the role of government. And this can be hard, as many of you know, in upholding policy, while making sure we have policies that support families who don't fit traditional norms, who have a variety of backgrounds. But it really doesn't matter whether they're conservative or liberal. We really have to be thoughtful about making our case. We just can't say things are needed and this is the problem, but we have to make a case for why they're part of what every decision maker cares about, no matter what party they're part of, and how this connects to their priorities. And so we're going to talk a little bit more about that need for collective messaging. And so I'll turn it over to Sara here.
Hi, thanks for the opportunity to be with you all today. And I'm just going to jump in for this slide and let Lisa talk a little bit more about wide shared messaging after that, and then we'll share some of the messages we've been testing. But I think a lot of you are probably already familiar with these frames. I think, though, it's important to think about different narratives that are being told and different mindsets people have, and the way that these can even play out in our own messaging efforts without even necessarily realizing that we're thinking about them, just because they're so pervasive in our society. And so some of the frames that we have here, just that kids are the sole responsibility of the family. And so there really isn't this role to play for government or for the community to come in and support. Another unhelpful frame that we think about and we're trying to work around with messaging is that there's this obviously the strong sense of individualism. And I think we see this play out with trauma all the time of pull yourself up by your bootstraps, just get over it. If you work hard, if you make good decisions, you'll have what you need in life and you can achieve whatever you want to achieve. And so this is probably one of the strongest narrative that we're usually working around, I think, in a lot of our advocacy conversations. I think as part of that, this idea that good parenting comes naturally and that, you know, it's a choice to be a good parent versus really thinking about what is in the environment or what is, you know, what options do parents even have, knowing and assuming the best intentions that they want to be great parents, and yet there's the conditions that impact their ability to do so. So that strong narrative comes through in a lot of messaging, and even as we think about direct family support messaging as well. Another frame is that just the basics. So I will say I take some of this from the Frameworks Institute that's really identified a lot of these, and they talk about this concept of just the basics where, you know, public assistance should be temporary. It should only be the bare minimum, which again doesn't leave room to talk about sort of that holistic support that people need and the role of government in creating those conditions for people to thrive. There's a strong narrative of us versus them. So it's those individuals that have problems that we need to help solve. We have to fix those people. And this really creates those stereotypes. And especially when you think about specific communities of color, Black families, the way that this plays out into some really hurtful and harmful narratives that perpetuate some of the racism that exists in our systems and in our society. You also have the deserving versus undeserving. So this plays out a lot, I think, in the sense of work, that if you work hard enough, you deserve these services and supports, not recognizing even the role of caregivers is maybe that they need to be home, or individuals who are unable to work. And how are we caring for people because they're people in our society and in our communities? And then finally, we have this unhelpful frame of the problems are just too great to be solved. And so when we come in and we talk about issues, it leads right away to the sense of, well, yeah, it's so complex, there's nothing I could do to solve it anyways. So I'm going to go over here and do something that I can address. So all of these are collectively, and there's more that we're working around. And the role is not to necessarily refute these or have an argument against them, but to recognize they exist and they show up even in our own conversations as we're talking about ACEs. And how do we create a different kind of narrative that doesn't evoke these frames that aren't helpful to getting what we want to happen?
Thanks, Sarah. And so as I noted earlier, the 360 portion of our name is very important to us, probably even more so now than when we first started. I think it's really important for those of us who work in the trauma movement to own that a lot of our previous messaging about whether it was ACEs or other trauma research may have perpetuated some of these frames. When we only talk about ACEs and outcomes, what we can unintentionally do is evoke a frame of blaming bad parents for the ACEs children experience, and that ends the conversation. As the ACEs movement has been building and we have learned more and more and brought different areas of knowledge together, we learn more about where we have to focus our attention to prevent ACEs, but also promote healing within our state, and how our message really has to support that goal. We know that environment surrounding a family, including the economic and social conditions in which they live, influence what happens in that household. Families need the things that you all care about: mental health services, childcare, social connections through home visiting. They need these things to be able to thrive. And so what we have here is an opportunity to really shift mindsets away from solely just blaming bad parents for the ACEs children are experiencing, and to really help the community and to help leaders see how we are at times making intentional choices that determine whether families have the right materials, have the right support, have the right resources they need to lay a strong foundation for their kids' healthy development. So that's not saying we walk away from how do we support parents, but it's to say it's an incomplete picture if we don't talk about the overall conditions of families. And I know even in our network, sometimes we get a little bit of pushback about that. But what's really important and what we really emphasize here is that families want to thrive and they want what's best for their children. But if they're stressed about whether they can pay for rent or provide food for their child, their attention is spent on survival rather than interacting with their child. If a parent has to work 2-3 jobs to cover the budget, they may have to leave that child with a caretaker they're not sure they can trust and spend even more time away from their child. So those are just a couple examples of the really real challenges that families face, and they're exacerbated for communities that are marginalized due to our racist systems, due to policies that prevent them from accessing essential needs and building those strong connections. So we've had a lot of look at how unfair lending practices have kept families of color from obtaining housing and have segregated neighborhoods, and then now they've lacked investment. And now we have families and children growing up in neighborhoods where they don't have opportunities, they don't have adequate schools, and they can't build wealth. All of these things play a role. And so we really have to take that holistic approach. And when we're forcing families into difficult choices, it doesn't lead to positive environment. It doesn't lead to positive experiences. So this is where we have tremendous opportunity to connect the dots and to really focus on families. And as we look at shared messaging, we have to have that common narrative so leaders can see how everything we're talking about is connected and focused on that shared outcome. Otherwise, it's too overwhelming and complex for those that have never worked in fields that we all work in. So as just a really brief example, Iowa didn't really, and some would say still doesn't have a children's mental health system until several years ago. And that may sound crazy. Happy to talk to you about it, how we did not have a connected way to refer for children and families who are in need, regardless of socioeconomic status. And so as advocates, folks really came together to say, how do we explain what is needed out of a system? How do we explain how our piece of the work, whether it's crisis, whether it's therapy, whether it's home visiting, how do we all play that part? But how do we all talk about that continuum of services that's needed? And when all partners in Iowa talking about children's mental health went on this messaging, it was that same legislative session where it finally passed, because everyone was talking from the single framework, regardless of their role within that framework. They're talking from that single framework. So I'll turn it over to Sara now to share more of the framing components.
Great. And I know we're getting a little tight on time, so I'm actually going to skip over this and show you some of that messaging we've been working on. And really know that this messaging has been shaped by doing research with national organizations that have really looked at framing. So Frameworks Institute, the Topos Partnership has been really instrumental in helping define this work. But it's also been based on a lot of conversations internally and with stakeholders to really think about what is the conversation we should be having around ACEs and how do we talk about that effectively within the political environment we're working in. And so not to say that we have the answers, because a lot of this is a journey and we're still testing, and this is a first round at really trying to bring together that unifying message. But this is the statements that we've been working on and testing and sharing with our stakeholders. And I'll point out a few different things that have really been key decision points for us. And the first is that this idea of starting with what's possible. So what is that vision and that solution that we want to offer versus starting with, we know that there's a really big problem and leaders need to do something about it. What we've learned through framing is that we actually need to start with, this is what our community and our state can look like. And then the next statement that we make is really connecting this idea of policies can remove barriers and create pathways. And I'll say that this seems obvious to some of us doing advocacy work, but what we've heard is actually that a lot of policymakers, especially in a conservative state, want to see less government. They don't necessarily see the role of policymaking in social well-being, in supporting individuals, again, because there is this mentality of a lot of these challenges are individual issues. And so it's our role to say, actually, the role of policies is to be here and centered here. And then you see this focus on community conditions. So taking it away from, this household issue or this focus on we have to help support families, to this focus on we have to create the conditions so families can make choices that strengthen their well-being. And that's been it's taken our team a while. And I think it's a really difficult conversation to have because it is a shift for a lot of people to think about, but it really is, we're not saying don't support families. We need to support families, but what we're saying is that focus needs to be on the community conditions that surround families. And this idea of make choices, so they're able to make choices that can strengthen their family well-being and foster their children's healthy development. This that make choices was really important, especially for conservative leaders, but even for all leaders in our state to think about that accountability piece as well. So we're not saying that families still are not responsible for their children's well-being. We're saying that we're creating the space so that they can make choices that allow their families to thrive. And we're actually even using the term freedom to make choices and really trying to utilize that term freedom again to say, again, a values-based conversation that we want to be having. And then we really want to highlight why that matters to everyone. So it's not just for the families, it's not just for the children themselves. Those are great outcomes and those are really critical outcomes. But we really want to talk about why it matters to all of us to focus on this, why it needs to be a priority for our state. And so these are some of the intentional decisions we've made. We've also really highlighted the intentionally making policy decisions as the role we're asking policymakers to make. So again, being really intentional about what is that ask, what do they need to do, what is our call to action that we need them to make, and making sure we're calling them to action. It's not enough to just say we should all do something about this, we should all play a role, but we really need to be intentional about saying your role is to do this. I want to be mindful, we are super tight on time, so I'm going to skip this, but this is a graphic trying to connect the dots. And I'll show you just a couple of messages that have played out. So we have done, it's probably going to be a little hard to look at both of these on the screen. I didn't realize they would just start playing, but we've also tried to distill these messages into really quick digital ads that we've shared throughout the state of Iowa in specific communities where we've known we've wanted to reach certain decision makers. And we've done postcard campaigns where we've had leaders write, we've had these postcards with these simple messages. We've given space for our partners to write a little message, and we made sure these got to every single legislator's actual home. So not just their office or at the Capitol, but we actually sent to their home address. And they might have gotten a few of them, so they would start to see that over and over again in the mail. If we have a quick second, should I just talk quickly about what we've learned? Because I think, is that good, Jen? Okay. I just want to highlight again that we're still learning and there's a lot we're trying to think about with this, but really what we've learned in doing some testing, we've talked to decision makers, we've collected feedback, especially during our legislative session this spring, but then into the summer. And what we learned is really that strengths-based message does work. It's hopeful, which is encouraging people to use it. It's also focused on people first. And as Lisa mentioned, it's not just that we're focused on workforce, so we're focused on getting, businesses to thrive. We're getting what matters most at the center of the message is the humanity of people and how we have to care about people first. And it's connecting the dots. It's a lot of dots to connect. And so we're recognizing that. And yet we feel it is really important to connect all of those dots between the role of policies to shaping the conditions, to supporting families, to supporting our state. And so, but we're working on how do we do that a little quicker and a little simplified, just so that it resonates without having to sort of sit and think about it in a long setting, because we don't have that amount of time. We are considering how do we be even more specific about the role of government in family well-being. So we've been a little general, but how do we be direct in saying the role of government is to do X, Y, and Z. We also are hearing from leaders that saying families are experiencing stress and adversity is not necessarily resonating, because again, there's the strong frame of, well, they should just get their lives together, or if they made better choices, they wouldn't be stressed or struggling. And so one thing we're also considering is how do we really ideally work with communities to elevate some of these examples and to have these conversations to show what's actually happening in communities, and especially our rural communities, and to not just talk about the ways in which some families may be struggling, but what is surrounding those families, what are those conditions those families are living in that are causing those challenges, and how do we focus attention there? So bringing in those experiences and that lived expertise element as well. And then there's still that need to educate on ACEs and brain development. So I think we've done a lot of work. There's a lot of leaders who at one time really knew what ACEs were in brain development, but new leadership keeps turning and at a faster rate than it's ever been. So we still have a role to do to have this conversation, but connect it back to the ACEs and brain development conversation as well. So I know we're beyond time. There's a framework that we can send that we've been offering our partners as well to talk about specific issues, if that's helpful, and happy to answer questions or come back at any point.
Thank you so much to you both. Really smart, strong, incredible work coming out of Iowa ACEs 360. We're so grateful. We're going to continue having conversations in the next few months as a group on our CTIPP CAN calls about how we can, I'm blanking on the word, but how we can use sort of this framework and integrate it into the messaging. And so next month we'll get together in more breakout rooms and continue the discussion about how we want to use this information to brainstorm our own messages. But thank you so much. What incredible presentations, and really appreciate it. If anyone has any questions, I'm happy to collect those and send them to Sara and Lisa. I will put my email in the chat. But thank you so much. And I will turn it back over to Jesse to close us out.
Thanks, Jen. Awesome presentations again from Jen, highlighting the great policy work that's come out from support from the entire movement. I want to thank Erin. I know she's not on the call currently, but a wonderful presentation to highlight some of the innovative work that's coming out of the federal government that we'll continue to build upon. And to Iowa ACEs 360, I mean, Sara, Lisa, thank you for sharing that. A lot of love in the chat, more to come. And to all of you, thank you for your participation and engagement, not just today, but throughout the entire year. Like Jen said, we will continue to learn and grow and build more and more opportunities to leverage the expertise and experiences that you all have, and be sure to integrate that into the movement as this movement continues to grow. While what Jen highlighted before about the successes from 2022 that we contributed to were so great, we are so excited about what will be possible, not just in 2023, but in the entire 118th Congress and beyond. So please sign that call to action if you haven't already. Send it to your network. We'll be in touch in the new year. For those that love the holiday season, please have happy holidays. For those for whom the holiday season is stressful and is not such a pleasant time, our hearts and minds are with you. We are thinking about you and sending love your way. You are not alone. Either way, we look forward to a wonderful new year and appreciate you all so much. Thank you again.